Hello everybody, it's SC and I'm back with a new video, the third video of this channel, and today's topic is anemia, the pathophysiology of anemia. Anemia is one of the most prevalent diseases in the world, hence we must study it. Okay, so let's start with the basic definition of anemia. What is anemia? So anemia is a condition characterized by diminished hemoglobin, HB stands for hemoglobin, or diminished RBC count, the red blood cells, the number of red blood cells per cubic milliliter of blood, or both in an individual with respect to age and sex. So the first part of the definition is very simple. If hemoglobin count is less, or if the RBC count is less, or if both are occurring, then we'll call this condition as anemia. But what does the second part of the definition mean with respect to age and sex? Why does it say so? Because hemoglobin and RBC vary with age and sex. So RBC count in a normal male is about 4.7 to 6.1 million per cc, whereas in female it's about 4.2 to 5.4 million cc per cc. And for hemoglobin, normal count in male is about 14 to 16 gram percent, whereas in female it's about 12 to 14 gram percent. Hence, if somebody comes with a blood report and it says hemoglobin is about 13, then we won't know whether this person is anemic if we don't know the gender. If this is a female, then okay, she's good to go. But if it's a male, then obviously the male is anemic. And also with age, hemoglobin and RBC count decreases with increasing age. Hence, this is a very important aspect of this definition. Now the question might arise that why do females have less RBC count, or why do females have less hemoglobin count? The reason is because of the female sex hormone, which is estrogen. This is present in females in high amounts, and this has a negative effect on erythropoiesis. What is erythropoiesis? It is the formation of RBC, erythrocytes, whereas testosterone, which is present in males, have a positive effect on erythropoiesis. Hence, males have more RBC and more hemoglobin in their body. So now we'll jump straight into the classification of anemia, and this is on the basis of etiology. Etiology means cause. What is the cause? Why is this person anemic? So number one cause of anemia could be due to blood loss. So blood loss is of two basic types, acute and chronic. Acute literally means sudden. So if there's a sudden type of blood loss, for example in a car accident, sudden blood loss, or if there's postpartum bleeding, like after birth bleeding, things like these are sudden causes of excessive bleeding, hence leading to anemia. Chronic is over a period of time there is a slow blood loss which accumulates and causes anemia. Chronic blood loss could be due to a peptic ulcer, or due to some internal bleeding, which is very very slow, gradual internal bleeding. These are causes of chronic blood loss. Okay, so the second cause of anemia is due to defective production. The production of the RBCs or the production of hemoglobin is defective. It could be due to deficiency of certain factors which are necessary for the production of RBC and hemoglobin. So in order to discuss this point, we have to know about the various sizes of RBC. A normal RBC is about 7 micrometer in diameter. So if there is anemia with normal sized RBC, then it's called normocytic anemia. Normal. If it's less than 7 micrometer in diameter, then it's called microcytic anemia. And if it's more than 7, then it's called macrocytic anemia. So microcytic anemia occurs due to the deficiency of hemoglobin. formation of hemoglobin, and hemoglobin is made out of three important factors. It's made out of heme, a globin chain, and an iron atom. So if we were to look at the structure of hemoglobin, this is the structure of hemoglobin. This is an iron atom in the middle of the heme. The globin chain is not shown over here. If we add globin, then it becomes hemoglobin. So these are the three components of hemoglobin. So if either one is deficient, then it leads to a certain kind of deficiency. If iron is deficient, it's called iron deficiency anemia. If globin chain is deficient, then it's called thalassemia. There are various subdivisions of thalassemia which we'll come to later. And if there's a deficiency of heme, then it's called sideroblastic anemia. Okay, now let's come to normocytic anemia. Normocytic is when the size of RBC is normal, so there is just a deficient production of RBC. This could be due to various reasons, like number one, there could be an infection. Infection causes a decrease in RBC. The main reason is because during an infection there is an increase in amount of hepcidin, which is a hormone, and hepcidin decreases the absorption of iron. So if there is a decreased absorption of iron, it leads to iron deficiency anemia. Another main cause of normocytic anemia is aplastic anemia. That means there is some kind of bone marrow deficiency in producing anemia. It's a bone marrow defect, and main reason for this defect to occur is due to radiation. Radiation is given during cancer treatment, and radiation can cause a defect in bone marrow which would lead to aplastic anemia. Certain hormonal deficiency like hypothyroidism, less amount of thyroid hormones, can also lead to normocytic anemia, because thyroid hormone is very important for normal erythropoiesis. Macrocytic anemia is when the size of the RBCs are very large, and this occurs due to two reasons. Number one is due to the deficiency of folic acid. Number two is due to the deficiency of vitamin B12. So both these components are required for the normal production of DNA, the RBC DNA. So since these are deficient, production of DNA is slow, but the production of cytoplasm, the normal other organelles, is okay. That's why it increases in size, and immature RBCs are formed. Immature RBCs which contain nuclei. Normal RBC does not contain nucleus, but this immature RBC contains nucleus, and such an RBC is called a megaloblast. Hence, vitamin B12 deficiency anemia is also called megaloblastic anemia. So we discussed the first two causes of anemia, which one was blood loss anemia, then there was defective production. Now we are coming to the final cause of anemia, which is hemolytic anemia. The hemolytic, what does the word mean? It means lysis, or lysis of the RBC. So there are two types of hemolytic anemia. Number one is intracorpuscular, and number two is extracorpuscular. So intracorpuscular means the causes are intrinsic. It is due to some internal problem of the RBC which leads to lysis. So it could be due to G6PD deficiency. G6PD is a hormone, glucose 6-phosphate dehydrogenase. It is required for formation of NADPH, which is a very important hormone which keeps the glutathione in its reduced state. So if there is no G6PD, there is no NADPH. So glutathione, instead of being in its reduced state, becomes in its oxidized state. So this is bad, because glutathione in its reduced state helps protect the RBC membrane from damage due to free radicals. So hence G6PD deficiency leads to damage of RBC membrane, and hence hemolysis. So this is one cause. Another cause could be due to sickle cell anemia. Sickle cell anemia is a genetic disorder which leads to a defective formation of the beta chain of hemoglobin. So due to this defect, the beta chains become very sticky and they tend to stick to each other, but not during normal conditions. During low oxygen tension conditions, the beta chains stick to each other and they cause sickling of the RBCs. So normal RBCs are biconcave in shape, but sickle cell anemia RBCs are sickle in shape. They are shaped like this. I could show you a blood picture of sickle cell anemia. Yes. So these are the normal RBCs. These are the normal RBCs and these are the sickled RBCs. And these sickled RBCs cannot adequately transport blood, and hence it is a problem. Another cause of intracorpuscular hemolysis is a genetic disorder, hereditary spherocytosis. So in the RBC membrane there are these certain proteins, membrane proteins like spectrin, ankyrin. These are normal membrane proteins. So a defect in these proteins or a deficiency of these proteins leads to a very osmotically fragile RBC. What does that mean? That a normal RBC would not allow water to enter it and cause swelling of the RBCs till a certain level, but these RBCs which are deficient in spectrin and ankyrin easily swell up and they are spherical in shape, hence spherocytosis, spherical RBCs. And these are very osmotically fragile. That means little bit of, even if they are in little bit of hypotonic solution, they will swell up and burst. Like this is a picture of hereditary spherocytosis. Very spherical cells. These are all very spherical cells. Normal RBCs are biconcave. So these are the three causes of intracorpuscular hemolysis: G6PD deficiency, sickle cell anemia, hereditary spherocytosis. There are obviously many other causes. Now what are the extracorpuscular causes? That means there is some extracorpuscular insult that the RBC is receiving. So it could be due to malarial infection. So the malarial infective agent, it enters the RBC and causes its lysis. So that's a problem. Or snake venom. Snake venom can also cause lysis of the RBCs. And another very important cause is erythroblastosis fetalis. Erythroblastosis fetalis. This occurs when, this is a very big case, so I'm going to bring it here. So this occurs when the mother of a child is Rh negative, the father of a child is Rh positive, hence the child becomes Rh positive. So this child is in utero, the child is inside the mother's uterus. The child is Rh positive and the mother is Rh negative. So during the firstborn child, there is no issue. The child is born, but during parturition, the mother is bleeding, the child is bleeding, there is some mixing of blood, and this mixing of blood causes the mother to get exposed to Rh positive blood. Hence the mother's blood forms these Rh antibodies. So during the birth of the second child, when the second child is conceived, again the second child is Rh positive, child number 2, and the mother is still Rh negative, but mother now has antibodies in her blood, Rh negative antibodies. So these antibodies will go and attack the RBC of the child, and it will lead to erythroblastosis fetalis, extreme anemia in the child. It is also called hemolytic disease of the newborn because it leads to severe hemolysis. Okay, so let's see another view to classify anemia, and this is solely based on the amount of hemoglobin in an RBC. So if there's more amount of hemoglobin, it would be stained very darkly. but if there's less amount of hemoglobin, it would be a very light stain. So if the amount of hemoglobin is normal, it's called normochromic anemia. Chromic refers to color. If there is less amount of hemoglobin, it's called hypochromic anemia. So less amount of hemoglobin. An example of normochromic anemia could be aplastic anemia, which I have already discussed due to bone marrow defect. And a very famous example of hypochromic anemia is due to iron deficiency. So the blood picture would be something like this. Over here we can very clearly see that it's very lightly stained. The RBCs are very lightly stained. So that's why it's called hypochromic anemia. So we are done with the causes of anemia, how to classify anemia. So what do we do with an anemic patient? What is the treatment? The treatment depends on the etiology. If the anemia is due to blood loss, someone has come after a severe accident, then we could give blood transfusion in order to save the patient. If there's been chronic blood loss, maybe due to peptic ulcer, then we'll treat the peptic ulcer. There's a treatment protocol for peptic ulcer. Now if the cause of anemia is iron deficiency, which is in fact the most common cause of anemia in women in India, so how do we treat iron deficiency? We give iron supplements. Proper diet must be followed, things like that. And if there's a genetic cause for anemia like sickle cell anemia, then obviously there are different treatments. There could be blood transfusion. For thalassemia you can also do bone marrow transplants, since the ultimate cause and defect is in the bone marrow. Bone marrow transplants are usually, the bone marrow donors are usually siblings. So treatment of anemia is variable. It depends on the etiology, the cause of the disease. So here ends our today's topic of discussion, which was anemia, the pathophysiology of anemia. I hope you liked this video, learned something from it. Keep visiting this channel for more content just like this.